This has never been recycled. So when they came in here, they brought in stoves, refrigerators, beds, cars. So I don't want you guys to think that this is from the homeless people. I mean, we get enough bad rap the way it is. But yeah, back up here was where, this area here where my shack was sitting at, wood burner. Of course, the old fire pit here. You used to be able to sit out here and the trail would go up here to the old trolley bridge. I go by Owen. I was down on the river for years. Primary health care, I mean, they helped give me my Social Security, disability. They helped me get my Social Security card. They keep track of my medical records for me because down there on the river, trying to keep any of your paperwork is impossible, you know. And that's why, you know, I can't say enough good things about primary health care. The reason why I ended up homeless is because I did roofing for years and my back got torn up. You know, once you get beat up and you have medical problems, people's not going to want to hire you. And on top of that, I was a drug addict anyhow, you know, and an alcoholic. I don't even know how many dumpsters I've climbed in, but all these here from gouges and holes, and from needles and syringes, climbing in and out of dumpsters and getting stabbed. You walk into a hospital and you're just covered with mud and dirt and you haven't been able to bathe for several weeks, you know, and you have no way of washing your clothes. The hospitals aren't going to want to deal with you. But when you go through primary health care, that's a whole different story. You know, I've never had one problem going with primary health care.
My name is Kelly Huntsman and I'm the CEO at Primary Healthcare Incorporated. Primary Healthcare is actually a federally qualified health center and we provide health services, medical, dental, behavioral health services, basically to all. It's a kind of a misconception sometimes that community health centers are actually free clinics or only serve people who are uninsured, and that's absolutely not the case. We actually serve all people. I feel like PHC really strengthens the community by being one of those providers that really can step in and fill in many gaps, whether it be a gap for healthcare, whether it's a gap regarding access to medications or behavioral health care or housing. Our broad range of services and the fact that we are that true medical home for patients and how we work with our partners really does help strengthen and build the fabric of the community.
The good thing about primary health, they have built relationships. And you don't build a relationship behind a desk. Go get you some old clothes, whatever. They don't have to be fancy. Walk down in there. And that's what they've done. They've built relationships. They've built communication between each other, you know. And they've been around enough to where they can tell from a distance if you're in a good mood or a bad mood by how you answer. If it wasn't for primary health care, I wouldn't be up here. I would not have gotten the medical attention for my back. I would not have had this apartment because, like I said, they've gone out and they've scouted around areas, you know, and they know that I wasn't going to leave this area. But then one day they says, come on, we got to show you something.
So one of the things that I'm most proud of is our staff who really steps up every day to meet the needs of our patients. We have a lot of vulnerable patients in our community and they have a lot of needs, and it's hard work. And our staff is just tremendous. They'll step up every day to do what needs to be done and oftentimes do way more than one would ever expect them to do. And they really do that because they care about our patients and what their needs are. So that's what I'm most proud of. I'm very proud to be part of an organization that really works to meet the needs of the community and really puts those patients first. I think the future for PHC is very exciting. Looking back on where we've come from, we've been in the community for over 30 years. We've grown from a small community health center to one of the largest in the state of Iowa, serving over 36,000 patients. And I think our future is bright. I think we can continue to serve that population well, expand the populations that we do serve, provide a broader range of services where the community needs us to do that, continue to step up and fill gaps as our community identifies those needs. So it's an exciting time. I think it's a challenging time to be in healthcare, but very exciting. And as things change, PHC will change and we'll really be excited to be a part of the community.